I'm Dave Jackson. Dave Jackson, yes. It's like 6:15 in the morning in my home. Made my first cup of coffee of the day. And I know a lot of you health addicts, because you follow me and let me know all the time that caffeine is not really all that good for you. But you have to do this thing that I call, and I got this from Dr. Dom D'Agostino up in Tampa, is the risk-benefit, right? Risk-benefit. So I'm risking this much of my health by drinking coffee, but what are the benefits that it gives me, right? So for me, there's more benefit than there is risk. I mean, in my head, of course, you can come up with as many excuses as you want to, and that's just the way this thing works. I look disheveled, just came out of sleep, right? Excuse me. And things are still waking up in this body, but it's a beautiful, beautiful Tuesday here in Naples, Florida. I want to tell you what's going on today, okay? This video may get me in trouble, and it may not, but risk-benefit, right? Always got that going on. So today, I think around 11 o'clock-ish or 10:30-ish, around that time, I will get the time right. As I approach the time, I'll start looking on my devices and seeing what time I'm actually supposed to be there. But I'm supposed to go to this pain management doctor, because, you know, all of this new pain management, or the stuff we used to use for pain management, we still do. It's just that it's so restrictive now, not so hard to get, because if you were just born yesterday, let me tell you, no, I don't mean to say anything to you like that, but people abused the painkillers, made them feel really good. In some cases, helped them bulk up on muscles and stuff. But a lot of people took them because of the feeling it gave them, and then they didn't really care what their body looked like. You know, they just wanted that hit. And you guys know what I'm talking about. So now they're called controlled substances, or they've always been called that. But these drugs that have been used for pain killing for cancer patients, I just wanted to make sure that you knew that most of my videos on here are for people who are in a cancer challenge, no matter how big or how small it may be. Right now I'm fighting one that is the liver and biliary area, bile duct, and the gallbladder area. So we've got to get these little cancers that I had completely blocked from last year, well, actually earlier this year, and we have to go through the same process again. I'm saying anybody that wants to follow, right? If you're facing a cancer challenge and you're a little bent out of shape with the chemo or whatever else they're going to do, or there's just something you want to hear, like a different opinion on how to treat this, and I'll never say that, at least out loud, that my way is the right way, because you know, it may work for me, it may not work for you. So you got to be very, very careful when you grab anybody's protocol stuff. Let's take this jar right here of melatonin, and you know, I take many scoops of this a day, and I feel that it's really helping me with my cancer challenge, right? So it works for me. I feel it works for me. But for you, you could be taking that all day and it may not work. Your cancers are crazily sly this way. Sly. That it has found a way to circumvent your melatonin or whatever you're taking, right? Excuse me. So you got to be very careful when somebody shows you something new, that you just don't go jump on board. Trying to look at a drug that I did that with. I got it down here on the drawers, but I'm not going to go down and get it. It's called Hemohim, and it's from Korea as far as I know. And you could tell anybody, that, hey, so-and-so took this and they swear by it, and it's like one of your friends or somebody you really confide in. So you're thinking, well, if it worked for Peter, then maybe it'll work for me, so let's try it anyway. So I've been trying that stuff. It's really strange because the people or persons that got me this particular medicine, and so far it's been funded by them, so I'm not being ungrateful or trying to kick anything here. I'm just saying that people who have never had cancer, who have never been down the path, are now prescribing the amounts of this stuff that you should be taking, excuse me, for your own body. And excuse me, gosh, let me get some of this coffee going. I'm so sorry. You'll come up in your head with what you think should be right, and then somebody else says, no, I think you should be taking 4 of those packets a day, and you've only been taking 2. It's like, whew, got to get with the program here. The other thing is, you have to sometimes think of what benefit is it to them now if they're like loved ones. Maybe they just want to see you get healed. If it's something else, like the more of this they sell, then the higher up they go on the pyramid or whatever, then that may not be what you're looking for. It may work, but and these things are very hard to know if they're working or not. So you got that too. That they're hard to measure. Most are. A lot of them you can measure right away and say, whoa, this is different. I took this and my white blood cell count went way down. So things like that, and if you haven't differentiated from anything else you've been taking. So got that. Today, though, the reason I said that this video may get me in trouble, and me, I'll make plans and then last minute we'll change them. Today is supposed to be officially my first day of chemotherapy on this new chemo that we're trying. It's immunotherapy, and I don't have a list of the drug out, but the more you follow this, me here on YouTube, the more you're going to get to know not only me, but the things I take as far as my cancer and how it affects me, okay? And, I'll be enthusiastic about it or I won't. And just normal stuff, right? So the reason why I'm putting this out there is because I could hardly find anybody else that was putting stuff like this out on YouTube. And again, for your own sake, don't take this as medical advice, because it's not. It's just some things that I have looked up and studied Usually Google scholarly articles or PubMed publications or different things where we're in the lab, like a scientific study of how this hemohim works or something like that. You look at it and go, wow, this is exciting that I'm going to be using, or however I found this, because some of the stuff you hear about in different people's protocols, and you cannot find the actual powder or medicine. A lot of it's just hit or miss, and I will mention those things because in your area of the world, you may be able to source it. Again, nothing is in my reach over here, so I was going to show you Shizandra powder, which is Chinese, and it's available on Amazon pretty cheaply, but it's supposed to do such a great number on your liver as far as bringing it around to a healthier liver. So what's been happening to me with the whole liver, bile duct, gallbladder cancer situation is, for some reason, and the reason I don't know is because I don't know how this stuff works. I'm not a gastroenterologist. Did I say that right? Wow. And I try to soak in as much as I can, but I never heard a case where, and I haven't studied too many cases, so this could be just like hearsay stuff, where the stuff that you're going to take is actually going to, make a big difference, and this is why I'm doing it, type of thing. But I also don't know exactly how that liver, bile duct, gallbladder combination works. But for me anyway, I've done like maybe 5 or 6 stents and stent replacements. And in doing so, I have learned a little bit more about my body. Now, for me, I would never think that your bile system could become so out of whack that it's actually producing more bile than it should. And when you produce more bile, you like throw your colon, that's your large intestine, into a spasm, which is painful. I get these air bubbles, right, that go around, they go right down the same way food would go. Feels like food. Some of it may be food. And it's even more powerful in the use of your abdominal muscles than food because it doesn't care. It just pushes, until it gets like a vacuum in there and pushes all the way around. So really strange stuff they don't tell you, right? So finally, this is August now, and July I think is when I had it figured out, or at least this is what I think's going on, that the bile duct is producing too much bile. And this one I may be able to show you. Yeah, not sure if that's frontwards or backwards or whatever. I'm sorry if it's backwards, but what this does, it's a repurposed medicine. It was designed for something else, that means. But they found that it also quiets the bile in your system, right? So you take one in the morning, take one in the evening, you're good. I got this from a Zoom call that I was doing with one of the surgeons that did my stent replacement. And we were just talking, and he had mentioned, he says, there is this repurposed medicine that we use, to slow bile down. Would you be interested in? I mean, as soon as he said that, with my background, I'm going to ask for like 20 bottles of this stuff. So yeah, I got that. And I'm not sure if it's working, but as I talk to you this morning, or whatever time of day you're watching this, I find that it might be interesting to double up on that. These medicines, or you read what do you call it, the side effects of the medicines. I mean, I do. Make sure you're not going to poison yourself here, right? And then take it and see what happens. Because what's been happening to me is no matter what time of day or night I eat, my colon will still want to do these spasms, like maybe 3 o'clock in the morning, all the way up to 6 o'clock, sometimes 2 o'clock in the morning. And it'll do this painful push, of either air or food or whatever it's doing, whatever time. You cannot control that. But for me, my control has been not that. Maybe this one, yeah. Hydrocodone. Which is a controlled substance. A very low dose, everybody tells me. But that bottle was pretty well full a couple weeks ago, and now it's like down to I take a lot of them. I take maybe 4 a day, sometimes 5. I've been taking 5 when this last pain wave starts coming in the early morning hours. This may or may not be happening to you. If it is, the way I dealt with it is I broke down and took another pain pill. I said to myself, I can't be in this pain, or I'm not sleeping for like 4 hours of the night because of the pain. And I got the pain pills to deal with the pain. And the other thinking was, by the time that I get through with that bottle, they will have my pain management prescription set up, which is some totally different medicine that my insurance company will pay for. There it is over there. Fentanyl, morphine, slow release, morphine, and then some kind of other opioid, which is some kind of opium or something, So all these plant-based things that you can't have. I don't know if fentanyl is plant-based. Who cares, right? For me and my discipline, I know, and I shouldn't say this because sometimes it jinxes the person who says it, and you actually end up with an addiction. So I was just going to say that I know that I have the discipline to not have this turn into an addiction. And so I don't care which one of those ones I'm going to take. But the doctor knows, which one probably is more addictive. Even though the strengths on these medications is more or less the same. It's like slow release, long term. I'm learning stuff, guys. So when my colon started doing these spasm things and the waves of pain, I went through many nights, guys, with that pain. Last night, I had a little bit before I broke down and decided to use the pain pill. And here I am thinking I'm going to wake the rest of the house up. And for some reason, this room must be awful soundproof, because people go, I didn't hear you screaming. And I'm just going, like, oh gosh, it's so painful, guys, help. The only way I get somebody is if I text them. That's 3 a.m. too. It's too funny. But that's the way it's been going lately, and I wanted to let you know that. So what's happening today would be the first day of my chemo, which involves those medicines over there. I can see it from here. I'm not going to be doing that. They're expecting me over there at 11, I think. And I also have blood work to be done over there But I want to get the pain management thing down first. There's several things actually that nobody, here's the deal with your treatment. It's your treatment. You can, at any point in time, stop or slow or just not go into the treatment that day. And they know how to do this. They will put you on a new schedule that will work with the chemo. Don't be worried about that, okay? So don't think that you're screwing up your whole and you're going to die and this won't work. And remember, no medical advice here. If you actually do die, I'm sorry about that. You hear what I'm saying though, right? If you followed exactly what I did and ended up passing away, we'd see each other in the great blue yonder. But it's just what I did, and it's working for me, is scooching my chemo time to the next week, right? And you can do this by either just not showing up and not answering the phone or calling and say, I just can't make it. So I could do either one because, I just told you a story probably 10, 15 minutes long about how the bile duct situation, the excess bile, is causing so much pain because it hits that spasm part. And who knew you could have a colon spasm? But it does bump up against a lot of these diseases like irritable bowel syndrome and other syndromes and diseases that trigger a reaction in your colon. And your colon is like, my colon anyway is like pure muscle. It's like a diaphragm, not a diaphragm, but I guess you'd call it a diaphragm. It's got these vessels where it pushes along things. It believes that it needs to push along this tract of your colon and get it out of the body. So, you got to figure out how to fight that. And with me and the constant pain, me taking these pain medications that I just showed you, I do not feel that I'm in a position to go in and do chemo. The other part of my body, which is the non-cancerous part, is not ready. That's not ready. I'm not strong enough. I don't feel. What they'll do is before they even start, they'll look at your blood numbers and say your blood work shows that your body is well enough to tolerate this chemo. But that's when you start. When you're done, it's like, okay, now you have to deal with the aftermath of the chemicals in your system, which is the side effects of chemotherapy. Everybody knows them. It's like diarrhea, feeling a nausea, and all that. Another thing is I didn't do, because this crept up on me, I didn't do the 72-hour fast that I normally do before going in for chemotherapy, any kind of therapy. And I really usually love having that window. My body doesn't complain, and in the area of chemotherapy, it actually there's this crazy thing that's part of my protocol that's like almost magic. The magical part is in the 72-hour fast, which helps your body send the chemo to the cancer cells and not hurt your normal cells so much, okay? So I don't feel well enough as a body. They may, but here I am getting up at 3 in the morning. That's not them. It's me. I want to get to the point where I feel like things are back to normal pretty much, and we can start, some different medications on this, namely this new immunotherapy chemo that they want to start on me, which is fine, This means that during this time that I would be taking this chemo, and I'll for sure go on this next week. I think I'll be well enough every day. This is the first day actually I felt good enough to do a video for you in such a long time. and I appreciate, you watching this. But when we don't have the chemo and the other medicines that they give you, and you're going to wait a week, make sure that I'm not saying that you do exactly what I do, but what I'm saying is I'm going to stick as much as I can to that protocol, because that's all I got to fight with is this protocol I developed, the fasting, sleeping, meditation, eating, the correct way as far as my clinical keto. All right. So, that's where I'm at. The only thing I have to do today then is go down and get the pain medication set up. And then from there on, I have some administrative stuff I have to do with my company, American Airlines. And I'll probably be working on that for the rest of the day, because I really want that to be in order, right? I want to go back to work as soon as I can, because they pay well, so I'm not really sure how to do that. There's people, though, that I can call or email. Isn't it funny when people say the best way to reach me is by email? Just think about that for a bit. The best way to reach me, guys, is either through direct messages here, or find me on social media somewhere, and contact me. Send me an email, direct message. I want to help you and help your loved ones or whoever you have. Not to say that if they do anything I do, they're going to have the same results. Probably not. But these are things that I have found, and the way they got pushed into my protocol is that they worked for me more than once, and they worked for others too. So I want something that we're doing in the protocol that works for the general public that has cancer the way you and I do. It's not like full-blown aggressive. Even not to say the diet part won't work with. I've seen miracles happen in that area where when you stop feeding the cancer, it actually starts starving and starts going away, even though you have a huge cancer in your body. But again, for me, I had to make sure it was the right kind of cancer. Some cancers get their energy differently. Some get it from carbs or sugars in your body, and others do get it from the fats in your body. So you got to be careful what you're feeding your body, and then how that trickles down to the cancer that you have. The last thing you want to be doing is feeding this thing. My whole idea is to starve cancer, right? All right, so that's all I got to say for today. Next video will let you know what's going on after the pain medication, what they gave me, and I'll take some. We'll see how it actually works. What I want it to do is to keep me out of pain the whole night so I can sleep, because sleeping is just as good as those chemos over there in my brain. Good night's rest will help your body repair itself. That's the way we're designed. Let me know how I can help you. Thanks so much for supporting me. A lot of you guys, because I use a tripod and don't move my face out of frame very much, have the habit of, because I've seen it, listening to me, my videos, and just putting the thing in your pocket, hopefully thinking that the pressure from your clothes won't shut the video down. I do that. But with me, you can kind of know that you can put it in that way, and we're not going to be going off mic or doing crazy stuff, at least on purpose, right? Thank you for your support. Thank you for supporting me financially, and just helping get the word out. It's so incredible. All right. So take care. Have a wonderful day. Make it a wonderful day. And we'll see you on the next video.